Good afternoon or good evening. I am Germán Guerra. I represent the Latin American Alliance for Global Health at the Global Network for Academic Public Health. It is a great honor for me to moderate this third session of the course Climate Ready Classrooms, a Public Health Faculty Development course on climate change. In this third session, we will focus on teaching heat and health, promoting adaptation and strengthening response. Before we turn to the speakers, I will briefly present the specific objectives of this session and some other important messages from the overall course. So if you want to see the captions for this session, for English captions, you just go and click on the lower part of the window, the CC button for English captions. For the case, if you want to have captions in Spanish that are also available, you can click on the link that should be displayed in the chat window. Para subtítulos en español, pueden buscar la liga que está en el chat para verla en este idioma. So as you know, we are now into the third session of the course, that it's on heat and health. And session learning objectives, there are 6 learning objectives. The first one is to identify current and projected changes to temperature and risk of extreme events, to identify vulnerable population vulnerable to heat exposure, including outdoor workers, agricultural laborers, individuals experiencing homelessness, marginalized communities, older adults, pregnant individuals, and children. The third is to define heat-sensitive health conditions, including cardiovascular, renal, respiratory, neurologic, and maternal diseases and pregnancy outcomes. The fourth is to explore the role of heat early warning systems and other measures in preventing negative health outcomes. The fifth is to examine cooling strategies, including nature-based solutions and their effectiveness in mitigating heat-related health risk at the community level. Finally, to evaluate city-level interventions aimed at heat mitigation, such as urban greening, cooling centers, and heat-resilient infrastructure. So, as previous sessions, this is a 90-minute session. We will start with a main lecture, and then we will present 3 case studies. After that, we will have a Q&A section that you should please, all your questions should be input in the corresponding area of the Zoom platform, so we can receive those questions. Those that will be through the chat will not be read, so please go through the Q&A section. These sessions are recorded, and the slides decks are available at the Columbia Plus website. But you have to be enrolled in the course Canvas via Columbia Plus in order to have access to these materials. And to enroll, please use the link that it should show in the chat. For the attendance, the attendance is tracked synchronously or asynchronously. If you opt for the synchronous attendance, you are automatically recorded when you join this session using your personal Zoom link. The attendance is not counted if you are watching this through YouTube or through a colleague's link. So please pay attention on that. And if you cannot make it to the live session, well, you can watch the recordings at the Columbia Plus Canvas platform, where your viewing will be logged and counted toward your attendance record using your email address that you use at the registration. For the certificate of participations, all those who attend 8 of 11 sessions and pass the final test with at least 70% of the score will be awarded the certificate of participation of this course, and it is issued from the Global Consortium on Climate and Health Education. You can join the WhatsApp group by this QR that you have there. It's shown now in the slide, and for their exchanges. And we will have 4 renowned speakers in this session. We will begin now with the main lecture by Professor Jason Lee. Then we will have 3 case studies by Professor Jan Semenza, Dr. Lady Lusambili, and Dr. Niels Sovereigns. I'm sorry if I am not pronouncing or mispronouncing your name. When I turn to each of you for the presentation of your case studies or the lecture, I will. You can correct me there if you want. So I will stop share now, and we will turn to the presentation of the lecture of Professor Jason Lee. He is a director of the Heat Resilience and Performance Center at the School of Medicine at the National University of Singapore. And Professor, thanks for your presence and very, very welcome. Over to you.
Thank you. Can you hear me loud and clear?
Loud
Good.
and clear.
Very good. Good morning, good afternoon, and good evening, everyone. This is Jason Lee. I'm actually right now in Budapest talking about heat and the aging population. So this online lecture on a similar topic and more is very timely. It is clear by now that we are experiencing increasing risks from extreme heat events due to climate change, with temperature rising, heat waves becoming more frequent and intense, impacting how we live and how we work. So my first point is, don't just think that is that 1-2 degrees rise. That is a mean increase. In real means summer will arrive earlier, it will leave later, and the fluctuations are going to be more aggressive. This will compromise not just the physiology, but our behavior response. And you will understand now why when a heat wave comes, for example, usually it's the initial first 2 weeks that compromises most. First, I would like to acknowledge my team members as I speak. They are busy collecting data like many of your team members, but I always want to thank them for the good work that they are doing. No need to imagine anymore. It has arrived. Yeah, so it's not a future conversation. Heat is really a silent killer. We forget about heat very easily because it usually hurts humans more than the infrastructure. So humans are actually very forgetful. We talk about heat, but I ask that after this lecture, you don't just be hearers of information, but do whatever within your means and capacity. Having said so, in extreme condition, we know both humans and the infrastructure can both be compromised. Extreme heat has many negative impacts, some of which are more visible, like you see from this slide, call it the surface of the iceberg, ranging from direct impacts of heat stroke and death, hospitalizations, accidents, economic loss. So these are quite well defined. But not many of us are aware of the more hidden indirect health impacts of extreme heat. Reduce incidental physical activity from where I came from and many parts of the world, especially near the equator. Incidental physical activity is almost non-existent, which means our total physical activity counts reduce. Increase risk-taking, chronic exposure impacts, myopia. You know, many parts of the world have nearsightedness issue. We have the sun, but because we have the choice to escape from the sun, therefore mental health will be exacerbated. These are often underlooked and under-quantified. Hard to sometimes capture good information. So there's a saying, right? If we cannot quantify, we cannot measure, it's very hard for us to augment and improve. These extensive impacts affect large populations, large proportions of the populations, and therefore they must be brought to light. Current trend shows a rise in temperatures and increased frequency intensity. These are all quite understood. But how heat affects you is very much contextualized. When you buy an apartment, we all know it's all about location, location, and location. I ask that as you go about doing such work, don't give general recommendation. A good heat stress policy, recommendations, guidelines must always be context, and hyper context. In some part of the world, it is not just about high temperatures, but it's also about high humidity and persist exposure. So our behaviors in that regard have been shaped and reshaped, resulting in poorer health. I will elaborate more. Overlaying all this onto inequality, many just don't have the capacity to deal with this added heat stressor and therefore are willing to compromise health in search for their livelihood. So I ask that you see from their lens, not yours. Don't talk about investment for now, for better health, better life to come. Many of the vulnerable populations, their priorities are livelihood. Now, so secure livelihood before you have any chance to talk about investment for better health. In my parts of the world, not now, but certainly back in Singapore, in Southeast Asia, and many parts, this is our family portraits. This depiction best represents us. Many of us, we are the boiling frogs. Another analogy would be, have you entered into a room that is very smelly? After a while, the stench disappears and you don't even know that you are living in an uncomfortable situation. We cannot allow this to continue. So to become more heat resilient will even be more essential as the world gets warmer. You can see how heat affects us. You can look at it from a health pillar perspective, life stages, population specific. Heat affects us. It's not just about heat-induced morbidity and mortality. So you think that there are only certain populations are being compromised. I can tell you many who are not the classical vulnerable populations are also compromised, not in the form of heat-induced death, but curtailing your potential of health and well-being. Heat-sensitive health conditions are essentially health conditions that become aggravated when one is overexposed to the heat. So to understand why this happens, let's first look at how our body's thermoregulatory system works. So imagine you have these conditions. Heat can perturb your physiology and therefore you will die potentially because of these diseases. But the assault often comes in the form of heat. Let me play this animation. So when exposed to hot environment or when exercising or working, body core temperature rises. A raised core temperature kicks off a series of thermoregulatory responses that attempts to cool down the body. One response revolves around the circulatory, we call it the system. More blood gets directed to the skin in a process called vasodilation, allowing more heat to be dissipated to the immediate environment, assuming that it's a gradient to lose the heat. This is where your heart beats faster to keep up with the body's cardiovascular demands. The other response you see here is sweating. As sweat evaporates, heat is removed from the skin surface. So guys, the key word here is sweat evaporation. Evaporation is the key word here. Sweating does not lose heat. Yeah, so this also will inspire us in coming up with innovative solutions to dry the environment so that our sweat can be evaporated. At this stage, our body can lose heat efficiently as the rate of heat loss matches heat gain. This is what we call compensable heat stress or compensable thermoregulation. Video is a little bit choppy, but here you can see a soldier that experienced heat syncope, vasodilation causing lightheadedness and therefore he fainted. And soon you will see another soldier collapse. I'll pause this video because it's very choppy, but the main point here is heat syncope occurs. But when heat syncope occurs, on the photo on your left, in this case, it can induce fatality because it's the same physiology, but in this case, because the safety harness wasn't on, he fell from height. And because the coroner took more efforts and attention to investigate what was the cause and concluded it was heat that caused the heat syncope, and then he fell from heights. So I ask that you go about quantifying even outcomes or ill conditions you never quite attributed to heat. Impact on heat-induced mortality, morbidity are significantly under-quantified. With chronic conditions, the body's ability to regulate temperature can be impaired, leading to increased physiological strain. This can exacerbate existing health conditions and make it more challenging for the body to cope with heat. So for example, here you see when overexposed to heat, demands on the cardiovascular system increases because the blood now is needed to supply the vital organs, if you are working, to the working muscles, and now to the skin for heat dissipation. This places an increased cardiovascular strain, and this strain on the heart can increase the chances of a heart attack or heart-related issues. Vasodilation can also cause blood pressure to drop. This can reduce blood flow to the kidneys, impairing their functions, and if this is chronic enough, can induce kidney injury. At the same time, remember the other mechanism to lose the heat is through sweating, and you hope your sweat can be evaporated. So excessive sweating can also lead to dehydration. This reduces our blood volume, so that now the heart has to work harder to circulate the blood, increasing cardiovascular strain. At the same time, when one becomes dehydrated over time, the kidneys have to work harder to conserve water, which can induce strain and potentially also lead to kidney or renal injury. So look at that, whatever conditions you have, even you don't have a chronic exposure, we are still uncovering the implication. How about the indirect impacts on heat on health conditions? A hot and humid weather can make it harder to breathe, especially for those with asthma or chronic obstructive pulmonary disease, or COPD in short. Heat can also worsen air pollution, including levels of ozone and particulate matter, which can trigger asthma attacks and worsen COPD symptoms. I said earlier, indirectly, thermal discomfort and decrease outdoor physical activity levels, and therefore reduce overall health and fitness. At the same time, existing conditions can also increase the risk of incurring heat stroke. When this happens, thermoregulatory responses become insufficient. As a result, now the heat gain exceeds heat loss. If no cooling is provided, one can enter into what we call a non-compensatory thermoregulation or heat stress, when the body core temperature now rises uncontrollably. So this is an animation for us to appreciate the process. So when this happens, right, the responses that help us in the compensatory phase may work against us instead. For example, vasodilation may help the body to lose the heat faster, but also the consequence of reducing blood flow to the internal organs. As a result, our gastrointestinal tract now receives less blood and therefore oxygen. The GI tract then gets damaged and becomes more permeable, which results in toxins leaking from the guts into our bloodstream. We call it endotoxemia. In response, the immune system is triggered. This results in a widespread inflammation, also known as systemic inflammatory response syndrome. If this persists, this can eventually lead to multiple organ failure. So this means that when somebody is already unwell, when you start him or her to work in a hot environment, you increases the risk manifold. This eventually leads to multiple organ failure. The excessive strain on the heart may cause it to fail, cutting off oxygen to other vital organs, eventually lead to damage to the brain. So if left untreated, heat stroke will cause permanent organ damage, and in worst case, death. So guys, it is actually not easy to die of heat stroke. When somebody died of heat stroke, it means the system has failed. And many who didn't die were already compromised. While the evidence is lacking, I think it's good to know some medications for treating chronic conditions may potentially impact thermal regulation. There's some evidence to suggest some common medications for diabetes, cardiovascular conditions, and neuropsychiatric or disorders can disrupt thermal regulation at different stages, making patients more susceptible to the heat. Again, the research is limiting. It's very difficult to undertake case control research for obvious reasons, but it's mindful to know that certain medications could compromise thermoregulation. I'm not advocating you should remove those prescription, but when prescribed during summer, maybe it's wise to also prescribe cooling measures, at least make aware to the patients that some of which could compromise their ability to lose heat. Beyond chronic conditions and medications, other factors can also make patients more vulnerable. Demographic factors that impair thermoregulation, as is the case for the elderly and the infants. Social factors such as low social economics and social isolation can also increase or expose them to more heat risks and therefore reduce their access to timely help. So be aware of these risk factors. And what can we do? What can the clinicians do first? Identify risk factors that make patients more vulnerable to the heat. Inform them about heat risks and symptoms. So not just education, the correct education. Educate the patients on steps they can take to manage heat. Potential adjustments to medication regime during hot seasons. And when patients are under heat stress, prescribe cooling measures in addition to those medication. Such knowledge needs to be imparted beyond this webinar. I think this information should be weaved into the medical school as quick as possible. I'm a physiologist, so I'm biased. There are many solutions, but I want to share with you physiological solutions. The good news is we have solutions at hand. These are not only effective, but very sustainable. Aerobic fitness, heat acclimatization, cooling, work rest cycle, and hydration. I want you to pay attention to the bottom half of this slide. There are three phases of which an effective heat mitigation strategy can curb heat strain, and nothing beats solid aerobic conditioning. Fitness, aerobic fitness, because I will show you in the next slide, that is one good investment you can make. Yeah, so as the world gets warmer, please take care of your physical health. Continue to exercise, because if the stressor is there, if you increase your capacity to the maximum, then you have a higher chance to deal with any stressor, including heat stress. This is my favorite slide. Without any heat management strategy, your potential, your safety will be compromised in a hot environment. So the good strategy must reduce, attenuate the rate of rise, increase your ability to tolerate heat. Now look at the y-axis. You have a new expansion of thermal capacity, meaning now you can deal with heat more effectively, means livelihood can be enhanced and potentially your health can also be augmented. Or we know heat is a showstopper, or at least a limiting factor in endurance work, especially in a warm environment. Over the past decades, there are solutions already developed. Maybe in other sectors, we can apply them creatively to beat the heat now as we face a warming world. So here you see a good physiological approach, very sustainable to reduce the start state, attenuate the rate of rise, and increase the limit. This will allow you to work more productively and safely in a hot environment. There are always individuals, for whatever reason, we call the rebound effects. So do pay attention as you go about providing heat measures in hope to reduce heat strain. Remember, many of them, of these vulnerable populations, are after livelihood. So you must also find ways to not allow them to overwork. Because when you get somebody comfortable, the natural response is now I can go out there and cut even more. Yet again, education to remind them is not just about livelihood. Now you secure livelihood, you shouldn't overwork, and therefore you can preserve health accordingly. I'll show you a technological solutions, not applicable in most cases to many vulnerable populations, but the concept is there. Here we show more than 150 runners running live in a half marathon. The future might allow us to see individuals real-time harnessing technology. But now adapt this to your respective context. You might not have wearables in the farm, but the point here is if you want to save everyone, you must monitor them or at least try to pick out those who are vulnerable and monitor them as closely as possible. In this case, using technology, it might not be the case in the farm, getting a next of kin, someone who is close, take him or her to the vulnerable population or the individuals in times of high heat stress. The person will be being responsible to provide this close monitoring. Finally, it is important to know the determinants of heat strain. After all, we are after heat strain. So don't assume that the hot weather often result in a hot human. There are three key inputs: the weather, the attire, the physiology of the person and the work, and the behavioral motivation. These are all important inputs for us to make a better estimate of the eventual heat strain. Yeah, so do not assume a hot environment always result in a hot person, and then take our guts down and assume that when the weather is not hot, humans will not become hot. That is not true. The integration of climate and health services is therefore vital to address this growing health risks from climate extremes and variability, as well as ecosystem changes. So I ask that climate services for health are a good form of partnership defined as the iterative process of collaboration between relevant multidisciplinary partners to identify, generate, and then to build capacity. Good climate services deliver and use relevant and reliable climate knowledge to enhance decision making and action to protect life and livelihood. So here is a good set of good practices, approaches derived from experience, gap analysis, expert opinions, and evaluation from research finding. So applying these principles should guide us towards a more successful partnership and therefore outcome. I want to point you there are many good resources out there, but here is one. The Global Heat Health Information Network is an independent, voluntary, member-driven forum of scientists, practitioners, and policymakers focused on improving capacity to protect populations from the avoidable health risks of extreme heat in our changing climate. So GEAN, in short, seeks to improve capacity of professionals, organizations, and governments to protect their populations from the preventable health impacts of extreme heat. I ask that you check it out. And earlier this year, as I said earlier, a good heat health advisory needs to be contextualized. There is no one size that fits all. So here you see the inaugural hub based at Southeast Asia, made for the region. This regional hub seeks to champion advanced partnership, collaboration, and advocacy within Southeast Asia. As I speak, there are evaluation of a South Asia hub, Latin America, Africa, so on and so forth. And I hope we begin to understand, and from those hubs, continue to build further nodes. Yeah, because the more you can contextualize it, you'll find that advisory will be more useful. I want to end my presentation with a short video to explain what the hub is all about. And with that, I will end my presentation.
In a world gripped by rising temperatures, we in Southeast Asia stand at the front line of this global crisis. We are experiencing more intense, more frequent, and more severe heat events, creating unprecedented conditions that are threatening our health, our lives, and our livelihoods. We have always lived with the heat and humidity, so it's easy to think we're used to it. But as the heat intensifies, we must ask, are we truly prepared for what lies ahead? Our countries, provinces, and homes are feeling the strain of increasing oppressive heat, with schools closing, work disrupted, and heat-related illnesses on the rise. The toll of chronic heat stress is also impacting our health, productivity, and mental well-being. The region's rapid urbanization and aging populations, plus socio-economic disparities, further amplify the impacts, making this issue impossible to ignore. The time to act is now. This urgency has led to the creation of the Global Heat Health Information Network Southeast Asia Hub, a regional initiative of the global network which is spearheaded by the WHO-WMO Joint Office for Climate and Health. Anchored at the Heat Resilience and Performance Center at the National University of Singapore's Yong Loo Lin School of Medicine, the hub will be central to the region's transformative action. Our mission: to foster collaboration, accelerate knowledge sharing, and catalyze evidence-based policy and action. By focusing on regional specific challenges and priorities to safeguard human health and well-being, we strive to prepare communities, protect populations, and empower individuals to thrive in a Southeast Asian climate.
Together as a region, this is our opportunity to build stronger, heat-resilient communities. For today, for tomorrow, and for future generations, let us commit to face these challenges head-on and build a heat-resilient Southeast Asia that can thrive in face of this warming world.
Together, let's rise above the heat.
พวกเรามาสู้กับความร้อนไปด้วย
Marine bertahan melawan haba. Cùng hợp thức phòng chống sốc nhiệt.
Daig natin ang init.
Bersama kita atasi rasa panas.
យើងរួមគ្នាយកឈ្នះបរិយាកាសខ្លាំងៗ
ก็สามารถเอาชนะอากาศร้อนอ้าวที่ท้าทาย
All right, thanks for your attention. What it means is it says let's rise above the heat. Thank you for your attention, and I will step back to take your questions after the following presentation. With that, thank you very much.
Thank you, Professor Jason. It was, thank you for your outstanding remarks. For me, it's how you present all these mechanisms for the indirect outcomes on heat on health. It's like an eye-opener. So thank you for that. And yeah, after all the presentations are done, we will take several questions for sure. So now is the turn for our first case study. It's will be presented by Professor Jan Semenza. He's associated with the Umeå University in Sweden and Heidelberg University in Germany. He's also the former head of scientific assessment section for the European Center for Disease Prevention and Control. And welcome, Professor. The floor is yours.
Hey, thanks so much. Tack för det. Very kind. Thanks for the kind invitation. I would like to speak about heat risk assessment and early warning systems. And I really appreciate Jason's introduction to the physiological aspects of heat. And I will take an epidemiologic approach. It's a very nice complement to this talk that's coming up. But guess what? So heat is here to stay, and we cannot avoid these impacts from climate change. Here, these families going on vacation, time to choose heat wave, heavy rains, or West Nile virus. We can't escape these climate-associated risks. And I got involved in this topic a long time ago, 30 years ago, when a heat wave hit the city of Chicago in the US. And I was asked to lead the CDC response to this emergency because it turns out that the medical examiner had to bring cooling trucks to the morgue to handle this overflow of bodies. And you can see here a cooling truck that's in front of the morgue where all these people were stored. And the newspaper articles were just going out of control with this incredible news about these deaths. So we were called in to the city of Chicago to figure out what was going on. And you can see here that we got a very warm welcome, a warm and friendly forecast. And so we started to investigate what was going on. And we soon realized that the medical examiner was in a political quandary because the mayor of the city of Chicago accused him of overinflating the numbers of heat-related mortality. Just because it's hot doesn't mean that people are dying from the heat. The mayor said that the medical examiner claimed that this is a true emergency. And so we went through the case definition for heat-related mortality, and we saw that he had used a case definition for a decade that looked at core body temperature at the time of death, and often that isn't possible. So he also looked at heat as a contributor to that death, or as a circumstantial evidence of heat contributing to that death if the individual was later found dead without another evidence of death. And so we examined the case definition and sided with the medical examiner and said that because he has used this case definition for such a long time, we do think this is a true emergency. And at that time, nobody really knew what these heat waves were all about because this was 30 years ago. And so we basically decided to investigate why did so many people die in Chicago. So we plotted out the heat index, which is illustrated the top curve here, which is a combination of temperature and heat, and then mapped out all these deaths that occurred in the city of Chicago. And you can see here that within a 3-day lag, there was a spike in deaths, and we grouped them into people that had died due to the heat, cardiovascular, or a combination of those risk factors, and included them in a case control study. So in this case, you can see the city of Chicago here with these dots representing individuals that had died during that heat wave 30 years ago. And we went and knocked on these doors to ask these individuals that knew the person who had died if they could tell us more about these issues of what led to that death. And I don't want to go through all the details of this because it's too complicated, but I would just want to focus now here on one particular risk factors, which is the lack of social contact among those individuals that died during that heat wave. In this case, we saw that people that participated in group activities were less likely to die. People that had access to transportation, those individuals that had friends in the city of Chicago were less likely to die. And so we saw that people that lived in social isolation were those that were at increased risk for heat-related mortality in Chicago. And these, in fact, are images of where people had died in the city of Chicago. This image here illustrates most dramatically what it means today to live in socially isolated circumstances in the United States. These are coffins of people that were brought to mass burial because nobody claimed their body. Nobody knew these individuals, and these people died alone. This is what it's like to be alone in America during a heat wave. So we recognized that something needed to be done about that. So all the information that we collected from our case control study was now integrated into heat health early warning systems, where we identified these risk factors for these individuals. And then we can basically now identify a threshold for when the risk increases. We can sound an alarm, come up with a warning to reach out to those vulnerable populations that we had identified, and then take action by bringing these people into cooling shelters or make sure that they take care of themselves so they don't succumb to that heat. So this early warning system was then implemented in the US throughout American cities, and heat-related mortality went down as a result. However, in 2003, there was a massive heat wave in Europe that killed something like 70,000 people, and the Europeans recognized that they needed to do something about heat-related mortality too. So here you can see European heat waves or temperatures over something like 140 years. And you can see how the 2003 heat wave was an incredible statistical outlier compared to the heat waves that they had experienced in the past. And that's why so many people died. And so the Europeans decided that they need to act on these heat waves as well. And they implemented these heat health early warning systems as well by defining these forecasts, coming up with risk conditions for health, and then set up a graded level of alert that you can see here in these rainbow colors on top, and then come up with timely communications and warnings to the public to save the individuals from heat. However, even with these heat health action plans, Europe still suffers from the extreme heat. And in fact, this one here is an image, a map of Europe from the 2022 heat wave that was unprecedented at the time. You see that excessive mortality in the southern part of Europe, with Spain on the left, Italy and Greece, that was disproportionately impacted by that heat wave now 3 years ago. But it turns out the year after that, in 23, we saw exactly the same thing happening. And again, it was now the hottest period ever recorded. So it beat the previous record. And we saw the same thing, high heat-related mortality, both in Spain, but also in Italy, in Greece and Bulgaria throughout the continent. So in summary, in 2003, there were something like 70,000 excess deaths. In 2022, there were 61,000 excess deaths. And then in 23, there was something like 27 heat-related deaths as a result of those heat waves. And obviously, those are estimates, and obviously the confidence interval needs to be considered, but still, those deaths were in the thousands. What does this mean? This means that our heat health action plans do not work. So we need to come up with a better strategy to improve these heat health action plans. And so let's take apart those 4 components of heat health action plans. Let's talk about the risk, where we need to understand the climate hazard, but also the exposures in populations and their vulnerabilities. We need to talk about how we detect those potential risks and protect people from exposure. How do we sound the alarm and how do we alert people and how do we take action? So let me walk you through those 4 aspects of heat health action plans. So let's talk about the risk first. So the risk is defined by hazard, vulnerability, and exposure. And through adaptation, we can in fact reduce the vulnerabilities in those populations, and we can reduce the exposure as well. So there are certain things that we can do to reduce the risk at the core of that Venn diagram here in the center of this diagram. And so when we ask about risk, we need to make sure that we examine these exposure pathways. How do people get exposed to the heat? We need to define the vulnerabilities in populations and then quantify those impacts from climate hazards and define those thresholds for impacts. The next step will be to analyze how can we detect potential risks and potential impacts. And so for that, we need to set up surveillance systems that monitor the health impacts. So we need to monitor climate-sensitive health outcomes. This could be pregnancy or mortality or morbidity, as we heard from Jason earlier. We need to set up passive or active surveillance systems. And then most importantly, we need to integrate epidemiologic data with climate data in order to link these type of outcomes with the hazard. And then we can develop a forecast that helps us to detect adverse health outcomes in populations. And this is something that I've been advocating for quite a long time, where we're trying to integrate all kinds of environmental data, climate data included, with epidemiologic data. You merge those data sets to integrate them, analyze them, and interpret them in order to take public health action. And that's illustrated on the 10 public health functions on the right here in this diagram. So that integration of different data sources allows us to take public health action addressing these 10 public health functions. And this one here is an example of that, the Forecaster and Health, which was built by Julian Ballester at IS Global in Barcelona, where he operationalized the temperature from on a regional scale and inputted that into this forecasting system to detect areas at risk. And this is just a snapshot that I took from last week. And now what he did here with his team, they used remotely sensed temperatures on a gridded scale, incorporated that into region-specific temperature lag mortality risks that allows you to compute the temperature-related mortality, and then you can attribute that death in a region to abnormal temperatures in that region. And this is what now this early warning system looks like. Here you can now detect temperatures that are responsible for impacts on human populations. And you can see that the southern part of Italy here now is projected to forecast to experience higher mortality in relationship to that temperature. So now this is one of the improvements that can potentially turn things around when we see these extreme heat waves that occur on a recurrent basis. Then the next thing will be to improve our alert systems and set up warning systems that reach communities at risk. The important thing is to engage communities in these type of alert systems and build effective communication channels to those populations, identify target populations and actionable messages so we can impact those populations. But the most important thing here is how do we engage these populations in these type of activities? And unfortunately, in public health, we have been very effective with these vertical programs, vaccination programs to eliminate smallpox or polio or things like that, where we administer one particular intervention to one particular risk population, but we don't address the underlying contextual issues that Jason spoke about so eloquently. And this is something that I call lateral public health, where we need to integrate these public health functions across the different sectors in society. We need to engage engage different commerce, but also community organizations and so on in public health activities, engage them in early warning systems as an example. And I have done a number of projects where we have effectively integrated these type of activities with communities. We engage them with community-based participation in social engagement. We increase the bonding social capital that allows people to solve problems in their communities and help them to build bridging social capital, which means that they can contact city officials and administrators that have more power than the community themselves. So you bridge them to people in government, and then together we can implement collective actions like building green environments that are that attenuate that urban heat island and minimize those potential exposures. So lateral public health is an approach to increase bonding social capital and bridging social capital to address community resilience against heat extremes, increase the decision-making process in those populations, and then address the hazard exposure and vulnerability that I mentioned earlier. And so the core components now of the action would then be to ensure that you ensure timely response. You need to make sure that you engage the community in these response activities and establish a line of command with the protocol and set up these actions. And so these are different aspects of these early warning systems. And I would like to encourage the teachers of this course here that are going out and talk with these public health practitioners to engage the community in how to improve our early warning systems, because they're working, but they're not working good enough. And so there's plenty of opportunities for young individuals that are engaging in public health to improve the systems that we have developed, because they work, but they don't work enough. And obviously the goal is to compress this epidemiologic curve by detecting an environmental signal, in this case, a temperature increase that's forecast over the next week or so, to set up active surveillance, find the first case, and then respond in order to suppress that epidemiologic curve. So in summary, early warning systems can trigger early action. These are obviously low regret options for public health because they improve public health capacity in communities, and they can potentially reduce the health risks if we make sure that communities are appropriately engaged in these type of discussions. And it's essential to build these systems in light of climate change, because climate change is here to stay, and we need to protect people that don't need to be exposed to this extreme heat. And here's my email for any people who would like to get in touch with me. And thanks again for your engagement and your interest.
Thank you, Professor. This was a very, I would say, like thought-provoking presentation, but also action-provoking, because all this idea of full lateral public health, it's really, really engaging and very suggestive too. So, tack så mycket. And now we turn to our second case study that will be presented by Dr. Adelaide Lusambili, who is a researcher at the Institute of Human Development at the Aga Khan University in Nairobi. And she is also the founder of the Next Gen for Earth. Welcome, Dr. Lusambili, and thanks for your presence here.
Thank you. Thank you. Yeah, thank you, everyone. Good morning, good afternoon, and good evening from wherever you've logged in from. Today, we are excited to present to you a short video of our work that was funded by Belmont Forum under the CHAMNA Consortium. This video takes you from research to co-design and to real behavior change interventions in Kilifi, Kenya. So the key thing is to show how community-led action can protect mothers and newborns in periods of extreme heat. Thanks for joining and listening. And I think the video will be shared. Send it.
As temperature increases, there is an urgent need to co-design interventions to reduce the impact of extreme heat exposure on pregnant women and their neonates. In Kenya, the Climate Heat Maternal and Neonatal Health Africa CHAMNAHA Consortium through the Aga Khan University has been working with community members in rural Kilifi to understand the effect of high ambient temperatures on maternal health, as well as to co-sign with the community members to identify priority interventions. Please watch our video story that summarizes CHAMNA research findings at
After findings from our formative qualitative work, it was imperative that we bring all the key stakeholders on the table so that they can begin to deliberate on the key priority interventions. The key stakeholders for our co-design workshop included pregnant and postpartum women and their support networks, who are mothers-in-law and male spouses. We also included the key influencers that work with women on a daily basis. For example, we had community health volunteers, community health extension workers, religious leaders, and government administrative chiefs. Our findings indicated that different policies from different ministries are required in order to reduce the adverse effect of heat exposure on maternal health. We therefore invited representatives from various ministries such as Ministry of Water, Agriculture, Meteorology, Education, Gender, Sanitation, Housing.
Our CodeSign workshop identified priority areas that are linked to each other, underscoring the need of multisectoral networking and collaboration. The priority intervention areas include improving water sources and systems, adapting the health facilities and home environment to reduce heat effects, greening the environment, improving early weather warning information systems, behavior change interventions. CHAMNAHA researchers further refined the priority areas for interventions in a consultative panel discussion with key policymakers from various ministries in a separate meeting. Our research found that there is no water and cooling spaces in many health facilities and indoor temperature is high. High indoor temperatures interact with a high staff-patient ratio, compromising the quality of care. Since many health facilities are far from the homes, many women miss antenatal and postnatal care for the fear of walking in the heat.
Currently, we are experiencing a lot of perinatal mortalities in Kilifi County. We can attribute some of those mortalities to heat. So the suggestions to reduce these mortalities, to ensure that we create 35 cool maternity areas. And then apart from that, healthcare providers need to be trained on the effects of heat for both the pregnant woman and the baby.
High temperatures in Kilifi interact with an extended period of drought affecting water sources. Water sources have dried and the available sources are far and contaminated, implying that pregnant women must trek for more than 5 kilometers to fetch water. This compromises mothers' personal and home hygiene. Mothers also refrain from drinking contaminated water, dehydrating them and their neonates.
A policy directive should be put in place to ensure that all the health facilities have gutters, have water tank to harvest the rain, and that then will translate to these other issues we are trying to address, because we are emphasizing on how to make that environment conducive and more healthy even for the dispensary.
Heat exposure in direct pathways through the built environment is harmful to both the mother and the newborn. Houses are made of low-lying roofs, are small, and have no windows. Indoor heat in these houses is unbearable because the homes are used for cooking, sleeping, and relaxing. Breastfeeding and the use of mosquito nets are challenging due to the discomfort caused by the heat, indoor smoke from cooking, and dust. The homes also lack shading. The community and policymakers suggested revising structural design policies to include features responsive to hotter climates, such as houses with higher wall heights, improved ventilation spaces, elevated roofs, and conducting research into alternative cooking methods to reduce indoor smoke. Most trees are cut for lumbering, charcoal selling, and firewood. A policy is required to regulate these. Suggestions for improvement from the CodeSign participants include empowering communities with civic education on greening homes, encouraging communities to plant fast-growing trees for firewood, growing drought-resistant indigenous trees with multiple benefits such as medicinal and fruit trees, and providing school children with drought-resistant trees and seedlings to plant.
Why don't we then have a policy in place that the environment department can work hand in hand with those enforcement officers? Then we have these people charged in court so that we stop that charcoal burning.
Kwamba tuweze kupata maofficers ambao wataweza kuelimisha na kuendeleza agroforest.
Chamnaha researchers observed that an early weather warning system that can alert pregnant and postpartum mothers about upcoming drought and extreme temperatures could help them and their communities plan to protect themselves from the sweltering heat. The available weather warning information on the radio and television is sometimes inaccurate, and many residents do not seek weather information, in part because the information is provided in English. Many rural residents in Kilifi depend on indigenous information weather communication strategies passed on from different generations, such as rainmakers and observing clouds.
Mabata pia utaona yanapiga hivi, basi ule umeme ukianza tunajua mvua iko tayari. Hizi ng'ombe unaziona zinaweza kuondoka mbio. Unaona inasimamisha ule mkia wake. Basi sio peke yake, nyingi zenyewe kabisa zote inaenda huku inaenda huku. Unajua mambo yako tayari.
But as we face this particular session of climate change, we want to revert back to our systems which were very perfect, were quite predictable, and they were very simple.
In addition, policymakers and community members emphasized the need to improve the delivery of early weather warning message in local languages, as well as capacity building the community health volunteers, chiefs, and other community leaders to assist in delivering timely messages in schools, churches, mosques, and communities. There is massive crop failure in Kilifi, and pregnant and postpartum mothers do not eat enough. Food prices are high, and low birth weight babies have increased. Community members linked food insecurity in these communities to low milk production among postpartum mothers, which is seen as influencing their ability to perform exclusive breastfeeding. Codesign participants underscored the need for more research to inform drought-resistant food crops and a policy to support pregnant and postpartum women with the provision of nutritious food. The priority interventions from the Codesign workshop that the Chamnaha researchers piloted was a behavior change interventions. Some of the cultural practices that researchers found that are harmful to mothers and their newborns are: many women continue to work with babies in the heat and perform heavy workload immediately after birth. This harms the baby's skin and leads to hemorrhage in the mother. The communities lack knowledge of the dangers of exposure. Babies are layered in many clothes due to the fear of being harmed by witchcraft, which may lead to dehydration. Some pregnant and postpartum women do not drink enough water because they fear contaminated water can freeze breast milk, or water from dirty and contaminated sources will harm their unborn child.
We piloted our interventions with a cohort of 30 family members. Our aim was to use a system approach to mobilize this community so that they can learn about the dangers of heat, as well as to be keen to support pregnant and postpartum women with heavy workload in periods of high temperatures.
We use community health workers to sensitize and educate the community members.
Tunapopata mama mjamzito huwa tunamsisitiza kunywe maji ya kutosha, tena ambayo ameyachemsha, ili kwamba yakaweze kuwa salama katika afya ya mwanadamu.
We also educated women and the dangers of heat exposure, the importance of drinking water, breastfeeding frequently, task shifting, and attending antenatal and postnatal clinics early in the morning when it is not hot.
Joto ni hatari sana. Hakikisha umechemsha maji ya kunywa na ukunywe maji mengi, na unamnyonyesha mtoto wako mara kwa mara. Halafu hakikisha kwamba usitembee na mtoto wako wakati wa joto jingi kwenye jua huku nje. Kaa kivulini na fanya kazi zako wakati jua limetulia ama asubuhi na mapema.
Towards the end of our interventions, we got reports from the community members that there was now increased awareness of the dangers of heat exposure, and also researchers observed a positive response from the rest of the community in supporting women in periods of high temperatures. In addition, even families that were not part of the interventions, the CHVs reached out to them to educate them more on the heat dangers. So in a nutshell, we felt the impact was massive. The chiefs disseminated our meetings, and the CHV actually included the heat danger messages in their daily work.
Central to our interventions was having local chiefs make a public pledge to support our project and reach out to other male spouses in the community to support pregnant and postpartum women.
Kutoka siku Mavia na mume wangu walihudhuria mafundisho ya Aga Khan, Mavia yangu amekuwa akirauka kunisaidia kuchota maji kabla aende kwa biashara zake. Naye mume wangu hurauka anachemsha maji kwa ajili ya familia.
Elimu hii ilikuwa ya manufaa sana kwetu sisi madaktari wa nyanjani. Sasa tuna ujumbe wa hatari ya joto jingi katika kazi zetu za kila siku, na tunaendelea kupeana huu ujumbe kwa jamii yetu.
Nachemsha maji na nanywa mara kwa mara, na namnyonyesha mtoto mara kwa mara ili tusipukiwe na maji mwilini.
Some male spouses reported facing cultural challenges performing feminized roles.
Hili shirika la Aga Khan walituletea mafunzo mazuri, lakini kwa sababu ya jamii ambayo bado inapenda kuhamasishwa, walinichukulia vibaya kwa sababu mimi nilikuwa mara kwa mara namsaidia mke wangu kwa kuchota maji, kwa kumtafutia kuni, hata kufua nguo wakati yeye ana shughuli nyingine. Sasa hawakuchukua vizuri vile, mara kwa mara walikuwa wanasema mimi nimekaliwa na mke wangu na vitu kama hizo.
The Chamnaha interventions, although piloted with a small cohort, revealed the need to scale up such interventions in rural African setting to sensitize and educate the communities on the dangers of heat exposure. Funding is needed to continue with this work in these settings and other similar settings in sub-Saharan Africa. We acknowledge the Belmont Forum for funding this work. We would also like to acknowledge all the research participants and all stakeholders, including Kilifi policymakers and all Chamnaha Kenya researchers.
Thank you. So, Dr. Lusamili, would you like to add something, or we just finish with this video?
I think we can finish with the video in the best interest of time, then we can take questions. Thank you.
Excellent. Thank you. Thank you for the video too. All these entry points for action that it's links very well with the previous presentations. So especially the one on the stress of heat on healthcare, it's for pregnant women, it's very, very important also. So finally, we have our last case study that is presented by Dr. Niels Soberins, who is a climatologist and researcher at the Remote Sensing Unit at Vito Research Center in Belgium. Welcome, Dr. Soberins. Please go ahead.
All right, also welcome from my side, and thanks for staying around for this last case study. So I'm going to focus a bit on urban interventions to mitigate heat and protect health of the citizens. The main problem with heat in cities is that cities, they tend to be warmer than the rural environment, and this is called the urban heat island effect. And knowing that the urban heat island effect is present, combining this with climate change, which makes temperatures even more warmer towards the future, you get really deadly heat in urban areas. And this heat exposure in cities is different during the day and during the night. At night, we see significantly higher temperatures in cities compared to the rural environment. While during the day, the temperatures are often similar, but the heat stress that people experience when walking in the city is bigger. And this is depicted on the figure on the right. When you're walking in the city during the day, you will not only receive direct radiation from the sun, but you will also receive radiation from the concrete, from buildings, from the floor, for example. And that makes you give the feeling that you have more heat stress when you are walking in the city. That heat is a big problem, has already been showcased by the previous presentations, but I still want to give this report of the United Nations that was published just a month ago, and mentioned that over 500,000 people die every year because of heat. And of this 500,000, about 36% occur in Europe and 45% occur in Asia. And in this statement, they also mentioned the importance of the urban heat island effect, showcasing that there the risk of overheating is the highest. If we talk about heat, we have to talk about the risk of overheating or the risk of experiencing heat stress. And if we would talk about risks, then this is a combination of 4 different factors. On the one hand side, you have the hazard. The hazard, of course, is the temperature that is experienced or the humidity that is experienced in a certain location. Exposure is, of course, the amount of people that are exposed to this hazard. And lastly, you have the vulnerability. And vulnerability is like, how vulnerable are you? Are you a person which has, for example, a previous health condition that makes you extra vulnerable for heat? This is an example of this vulnerability. Lately, in the new IPCC reports, you also see a 4th factor that is popping up, and that is capacity. That is actually an overview term of saying, like, how can you protect yourself from the hazard? And this is, for example, if you have an air conditioning available at home, that is capacity that can potentially cool yourself. So these things all need to be taken into account when we talk about heat risks. The question is now, how can we lower these heat health risks? So we know from the hazards that heat waves will become longer and more intense. So the way to lower the heat hazard is by mitigating climate change, or ensuring that temperatures do not rise too much towards the future. From exposure, we live and we work in very hot environments. So we can, for example, as a measure, adapt working conditions or legislation to make people make sure that people don't work in too hot conditions, for example. Vulnerability. So like said in the previous presentations, also like elderly and infants, they are more vulnerable to heat, and you have these cardiovascular diseases that are a precondition for extra vulnerability. So when doing interventions, it is important to find like focus areas where people with these conditions are more living, for example, or more present. And lastly, the capacity factor, the ability to adjust and cope with the consequences, are then heat reducing interventions. This can be at different spatial levels. If we talk about measures that cities can undertake to adapt to climate change, there are actually 4 levels at which these measures can take place. The first one is at infrastructural level. Okay, so this is changing how your city looks like. You can, for example, try to cool the roofs so that indoor the temperatures become less warm by painting them white or providing vegetation on the roofs. Provide extra shading in your city by planting trees, for example, or increase the insulation of houses, for example. The second level is at institutional level. These are, for example, the heat health action plans that can be stipulated at a city level or at a governmental level, and that come into place at the moment that the heat hazard strikes a city or a region. The early warning systems have been discussed quite a bit already, and better awareness raising, as was also shown in the last presentation. Behavioral measures are also very effective in adapting to these heat stress. So adjusting work schedules by not working or not doing a lot of physical activities at the hottest time of the day. Increasing hydration, as was pointed out in the first presentation, is also very important to reduce heat hazard. And find these cool spots in your city or in the place where you live to find heat relief. A last one, which is also a bit overarching, is our nature-based solutions. These are changes towards your city also, like creating urban forests, green spaces, and water bodies that all effectively reduce temperatures and heat stress in a city. In the next slides, I will give a few examples of heat hazard adaptation studies that we worked on at Vito in the past years. This was already discussed a lot by Professor Semenza in his presentation, but I want to pick up into this with one example of a effective or a good example of where this heat health early warning systems really make a difference. And this was in Ahmedabad in India. They have now a heat early warning system in place. And what you can see here is results of how the hospitalizations changed during several heat events. So you can see here at the top, when the temperatures go above a certain level, here you can see the number of hospitalizations before the heat health early warning system was into place. And on the second line, you can see how many hospitalizations there were after the early warning system was in place. And there is really a significant decline in the number of hospitalizations. So these heat health early warning systems, they really work. A second example that I want to give is a project that we did in Johannesburg, South Africa, focus on urban greening. And what we first did was do an analysis of the urban heat island effect in the city of Johannesburg. Some might recognize it. And what was very peculiar was that we saw that certain areas really popped up as being hotspots of being much warmer than the rest of the city. So here, for example, in the southwest and here in the northeast and also in the city center, you could see some really warm spots in the city. And what we did is we looked at how is the vegetation distributed in the city. And you could nicely see correspondences between the areas where not a lot of green is present and where the hottest temperatures are present. An extra additional factor that comes into play is that there is still a lot of differentiation in the housing conditions in Johannesburg. And this is a very peculiar image, satellite image that you can see, where you can see the discrepancy between the slums where almost no green is present and the richer areas where gardens with trees are present and which therefore also experience much lower temperatures. So this adds an extra layer to the inequality that is present in the region. Another example that we mentioned were the cool roofs or improved insulation that are options to reduce heat exposure when you are indoor. This is a thermographic image of a picture that we took actually also in Johannesburg. And then you can see at the top image here what the temperature is of these different surfaces. And you can see these white surfaces are much cooler than the black surfaces that we see here. And of course, this heat that is absorbed by the black surfaces, they also penetrate to the indoor location and can create very high temperatures in indoor locations. What we did is in the city, we had selected 16 different houses or dwellings in which we placed these heat stress sensors. So they measured how much the air temperature and the wet bulb temperature was inside at a certain moment of the day. So the orange line here it showcases the outdoor temperature, which was 26 degrees. And the blue and the red bars, they showcase the temperatures on the one hand side or the wet bulb temperatures inside at the same time everywhere. And what you can see is that there are huge differences between houses. So there are houses where temperature only gets up to 21 degrees, but there are also houses where the temperatures can go up to more than 35 degrees, showing that the inequality in housing, insulation, and the cool roof that they have or not have can have a huge impact on indoor temperatures. Another nice example of work where we contributed to is a work in Barcelona, where they introduced community cool spaces or heat shelters in their city. So what they did is they identified both indoor and outdoor places that are cooler in the city. And they said, okay, we're going to open these spots during heat waves for the population or for our citizens so that they can come here and find refreshment of the heat during the hottest hour of the heat wave. And this was very positive, but an important thing to note is that communication of the availability of these community cool spaces and awareness rising is really key to make people go to these places. Another example is from Johannesburg was the advantages of agroforestry. It provides not only cooling benefits, but also social, mental, and extra food security, and even extra household income. And the best option to do and this agroforestry in a city is to combine the ground crops that you can see here with interspersed trees. That is the most effective way of providing cooling. Another example is that we have to protect our workers and ensure labor productivity. This was also shown in a previous presentation, that you could see that when the temperature goes up, that working productivity can go down. And this, of course, has an impact on the economic output. So we did a study in 3 cities in India. And what you can see here is the amount of GDP that is at risk at current time periods. That is the blue bar. And towards the future 2050, middle of the century, under 2 future climate scenarios. The green bar is a low emission scenario, and the orange bar is a business as usual scenario. And you can see that really several percentages of the GDP are already currently lost and will increase towards the future because of heat stress and decreased worker productivity. An important thing to notice is that interventions are really context and region specific, and not every approach is valid everywhere and every time. This was a study that was executed in Belgium, and that showcases that what we try to do is check how do urban forest or urban savannas contribute to decreasing daytime and nighttime temperatures. What we saw was that urban forests were very efficient in reducing daytime temperatures because they avoid penetrating the solar radiation towards the surface. Urban savannas, which are more open, they had more radiation coming through and were hotter during the day. But during the night, we saw the opposite effect. The closed canopy of the urban forest prevented radiation from the surface to escape towards the sky and kept the surface the trees were forming a blanket as such over the surface, which prevented it cooling. And there we saw that urban savannas were more efficient in cooling. Do all these adaptation measures work? That is then the question. Yes, we saw it already with the heat health early warning system. This is another study from Prague, where we did a mix of, or simulated the effect of a mix of adaptation measures. And we could see that you could reduce the amount of people that die from heat stress by 30 to 40% in different cities in Europe. Important to notice is that heat adaptation is does not only work, does not only prevent mortality, but studies have also shown that they are cost efficient. So what is shown here is the benefit cost ratio of investment in these urban heat mitigations. And we see that heat health early warning systems, for example, have a very high benefit cost ratio. So they save much more lives than that it costs financially. And also like urban greening and cool roofs are very cost efficient in providing urban heat mitigation. To finalize, I would like to end with this slide. And these are some recommendations on how cities can adapt to climate change. And the first recommendation is that heat mitigation needs to be mainstreamed across all city actors and all the different departments of the city. Citizens should know how they can mitigate heat stress. Employers should know this. Health officials, meteorologists, in education, this should be really taught so that everyone is aware of what options are available. When you plan any measures in policy, let's say, over your city, it is very important to have this, we call it a climate reflex. It's like, if I want to change something in my city, is this also from a climate perspective sustainable? So this is very important to take this into account. Several cities in India, for example, now have employed a city heat officer, and they really play an important role in bridging different departments of the city. So bringing together like the health departments, the construction departments of the different city, and make them talk to each other and take heat mitigation really serious. And lastly, in all public tendering procedures of cities, of changes in when you build a new city quarter, for example, climate concerns should always be incorporated as that they should be considered when doing changes towards your city. So this is my message to everyone working in the field. Thank you.
Thank you so much, Dr. Niels. It's been I think for me, it's ending in a good note, like having this collection of solutions. It's very inspiring to try to mitigate these heat waves and all their consequences. So, well, now we open the session for questions and answers. I have counted around 40 questions, so it will be very challenging to go through all those. And we have decided to only pick one for each of the speakers. So in the order they presented, we would start with Professor Lee. And the question is, it says, how can a heat-specific indicators be developed for low and lower middle income countries where heat-related information are difficult to extract?
Thank you for that question. My immediate response is, let not perfect be the enemy of good enough. Yeah, I'm aware because a lot of this scientific information, therefore guidelines, were actually derived from places not which you described. And therefore, I can fully understand a lot of this data required to effect, may it be a warning system or action plans, sometimes do not mean a lot to the ground. Let me give you an example. And I was at the outskirts of Thailand, and they told me their heat health warning system works something like this. When they feel the weather is very hot, 2 young men or women will run across that street and then shout, "Take care of yourself because the weather is hot." That's it. On one hand, you might find that is too simplistic, but I was totally inspired that they took ownership, that when the weather is hot, they bother to run down that village. They were so precise that the village, probably 122, not a big one. They know everyone them, and therefore they took actions. So I think we have a lot to learn coming from where I am, that we thought we need all these 10, 21 indicators before we can effect a heat health warning system and action plans. Yeah, so I don't have a good answer, but I would just say do whatever you can. And if they say you need these 5 inputs like dry bulb, wet bulb, wind, solar radiation, form the WBGT before you can effect the heat index, and you say I only have 1 dry bulb, so be it. I don't even have a dry bulb thermometer, but I can feel the heat, so be it. So do whatever you can, but constantly enhance the system within your means. But if I may, right, more importantly, I don't think it's just a heat health warning system or action plan. At the end of it, the recipients must use your warnings. That is something I feel, and I think Professor Yan briefly mentioned about that. I want everyone to think, now you are that farmer out in the farm cutting. Do you think, honestly, when the warning system say that if you continue to work that hard, you may get heat injured and therefore you should slow down and not work so hard? I think that is a bit naive for us to think so. Because if I'm the farmer, I will look at you and say that, after all, you are telling me I may get heat injured if I work equally hard. But if I don't work equally hard by 6 p.m., it's not a risk conversation. My family will suffer because I will cut later. So they will disregard all these well-intended evidence-based heat health warning system and continue to work hard. My point here is whatever we do, we must ensure the livelihoods are first secure before we think that the recipients will take actions. So therefore, provide the resources for them to bother to take actions when the warning system arrive one day. Thank you.
Can I build on what Jason just said? So that's exactly true. I totally agree with him. And let me give an example. So like in Nepal, there was a river that split into two branches. And on one branch of the river, the community was engaged in preparing for potential flood and early warning systems. They set up a committee that would read the gauge on the river to see when potentially they need to sound the alarm. And everybody was engaged in the decision-making process and the outreach and everything. And so they have a very strong community engagement. This is what I call lateral public health, as opposed to vertical public health system. It's an open box where you connect with the community. You need to bring the community to the table. And then on the other branch of this river in Nepal, people were not interested in that. They had other issues to deal with, like making a livelihood, as Jason said so nicely, right? So they had so many other issues to deal with. They did not engage in the early warning systems. And then in 2012, there was this massive downpour that they had never ever experienced before. And so this river was now impacted by this extreme weather event. And in the community engaging area, people were able to sound the alarm very quickly because they were able to read the river gauge. They were able to get the message out to people at risk. They were able to move the movable assets out of harm's way. They were able to get people out of harm's way. And so they were able to protect themselves. But in the engaged side of the river, thousands of people died, many more so than in the other side, because people didn't get the message, they didn't act, and then they were impacted by that environmental climatic disaster. So it is essential for every early warning system to engage the community, as Jason put it so nicely. We need to make sure that people are engaged both in the co-design from the very beginning, in the operational phase, and then in the outreach. Otherwise, it's just not going to work.
Thank you. I've just got a message from Professor Lusambili, who is leaving, so I'm gonna turn if she would like to answer her question that I have for her before we turn to the previous order. So, Dr. Alaide, how has indigenous knowledge influenced the development of scientific early warning systems for controlling heat stress? Do you have some thoughts on that from your experience and your work?
You're muted. You need to unmute.
Thanks so much for asking that question. And it's a question I can't fully answer at this moment, because we actually don't have evidence now or at the moment on how indigenous knowledge has impacted or influenced the modern weather warning. But it's one area where we are, as you saw in our video, it's one area where we are actually suggesting that more work is done and a neutral ground be found on how indigenous knowledge can work alongside the modern weather warning systems, because you see there are so many barriers even to accessing modern weather warning system, and the reach is really low in low income setting or in rural Africa, as you can see, because the rural folks still believe in indigenous early weather warning system, which sometimes works, sometimes doesn't work, whereas the modern weather warning actually don't have heat health early warning systems in place. For instance, the system covers everything, but when we focus on the health of vulnerable communities, the messages really need to be targeted. So what I can say now is that we need more work on that, and nobody actually at the moment understands how indigenous knowledge has influenced modern weather warning systems. There's still more work to be done. Thank you.
Thank you so much, Dr. Lusambili. Now, Professor John, there are like two questions that are related. So the first one is, what variables should be considered for heat surveillance? And in your opinion, what type of heat index is the most accurate for risk assessment for early warning? Some countries use temperature only, but some use the wet bulb glove temperature that some of the presentations from Professor Neil Sovereigns show that index. So what can you, what's your input on that?
Yeah, so the system that I showed, this forecasting system that I mentioned earlier, that surveillance system uses an exposure response curve, the relationship between temperature and heat, and computes the mortality in relationship to those climatic conditions. And so you can then identify not 3 areas or small districts that are at increased risk based on a mathematical calculation of where the risk is the biggest. And so in these models, temperature is sufficiently good to identify high-risk areas, and that's fed into the model. But as I showed as one of my slides, humidity is a big factor also, because if there's a lot of water vapor in the air, obviously people can't sweat as effectively and can't cool down. So it obviously impacts heat, but for these models, temperature is a very strong predictor that works pretty well.
Thank you. The organizers told me that we can extend 5 minutes to 10 minutes at most. So this question was to Professor Jason originally, but I think it's a question that would fit any one of you. And if you would like to, in addition to the questions, answer, this is about, it's on the purpose of this course, of course. It's do you recommend any toolkits or reports to teach heat? So of your experience, your teaching resources, what you could come up with, mention to recommend would be great. And now we have the questions to Dr. Sovereigns. The question is, just a second. Okay, it says, vehicular pollution is a critical driver of the urban heat island effect, particularly at traffic signal junctions where idling vehicles can raise local temperatures by 2 to 3 degrees Celsius compared to surrounding areas. What measures can be taken to address this issue? So over to you.
Yeah, these are indeed, like, these squares are hotspots of temperature, not only because there's a lot of concrete, but also because indeed there are like these anthropogenic factors that contribute to extra heat in the area. So it is important to provide as much green in these squares as possible. So try to get trees at the edges of these squares, for example, so that they can provide shade. That's already a very important factor. And unsealing as much as possible. Of course, on a square, this is difficult, but where possible, in the middle of the road, for example, at the separation of the 2 lanes, that is maybe an option. So these are really effective measures in decreasing the temperatures there.
Yeah, I think also like joining with some discouraging the use of vehicles would be also good, right? Or public transport, so that it could synergize the solution. But yeah, it's good to think that way. So anyone if want to share, I mean, I see that you have designed this dashboard in Barcelona. It was very interesting, but any teaching kits or resources that you would like to share, it would be very great.
So there are 2 resources I would like to mention. So I'm part of the Lancet Countdown, which is a group of researchers that are developing indicators for the relationship between climate change and health outcomes. And I would encourage you to read the Lancet Countdown reports. Depending on the region you live, there's a global one, there's a European one, there's a Chinese one, there's an Asian one, there is a Latin American one. So there are different reports that have been written as part of this Lancet Countdown initiative. And there are lots of indicators that you can look at. So how do the populations, for example, become more vulnerable to extreme heat? So how is the heat how are heat waves increasing? How is heat-related mortality increasing? And the relationship with air pollution and all kinds of indicators that are extremely useful for teaching purposes. So that's one thing, the Lancet Countdown, I would like to draw attention to. Then in Europe, we have something that's called the European Climate and Health Observatory, where we upload all our indicators that we develop for the Lancet Countdown Europe. And here you can play around with the data and see how heat-related mortality is increasing over the years in relationship to temperature, how the climatic suitability for infectious disease is increasing, and all kinds of aspects that might be of interest to you. So again, the Lancet Countdown or this observatory, those are two great resources for professionals that would like to teach about the relationship between the climate and heat-related mortality.
Yep, I just want to add, Lancet Countdown, which I'm also part of, is a good resource. And the other one I briefly mentioned in my presentation on the Global Heat Health Information Network. Besides the information, there's also a list of experts from different parts of the world. As I say, heat, I mean, all good advisory needs to be contextualized, but I can tell you heat advisory needs to be hyper-contextualized. So find out the expert nearest to your region and then work with him or her, co-create. And we also learned, right? Good solutions are often not used, partly because they are not co-create with the recipients. And Professor Yang reminded us again that is this human's biasness. If I'm not part of the development, even it's good, I don't see a mistake in this. So that's where the psychology, the behavioral sciences come in. So do start with the end in mind. And if I may, right, you talk about heat index. Today, there are more than 250 heat indexes out there. It gives us a clue. Please don't develop another heat index. That is good. Use one that you can use, and then within other components. Because as I briefly say, it's not just about the environment. It's about the tire, about the physiology, about the paying model, the behavior response. The more you can consider, the resultant guesstimation or estimations will be more accurate. But do it. Don't perfect the plans. Because as we speak, lives and livelihoods are being compromised.
Thank you, Professor Lee. It was very inspiring, the last remark. So if there's no other comment, Niels, maybe a closing remark, it's okay. Well, then we finish this session. I'm very grateful to the presenters, but also to the organizers, Dorothy, that's online, Daniele, Professor Daniele, and Maggie, and all the people that made this session possible. And we see next week for the session 4 that it's climate change, air quality and health, risks, vulnerabilities, and solutions. So you really paved the way for the next session, and thank you all. And again, good morning, good afternoon, and good evening.
Thank you.
Thank you.
Bye.